Good morning, everyone. Welcome to the Montgomery County Council's Tuesday, April 20th session. First, I'd like to say Assalamu alaikum and wish our Muslim community a Ramadan Mubarak as we celebrate this holy month. We will be recognizing Arab American Heritage Month momentarily, but first we will begin with recognizing Sexual Assault Awareness Month, and I'll turn it over to Councilmember Evan Glass.
Thank you very much, President Hucker. Good morning, everybody. This month marks the 20th anniversary of Sexual Assault Awareness Month, which was initiated to raise awareness on the need to prevent sexual violence, abuse, and assault in our communities. Sexual violence is a public health crisis that has long-lasting health, social, and economic impacts on survivors and their communities. And these violent incidents often go unreported, but they undeniably have a ripple effect on the people's lives and their futures. As we return to in-person activities, as we come through this pandemic, we are all becoming more aware of what some have been calling the hidden pandemic. With all of us being home more often, many victims have found themselves stuck at home with their assailants, unable to leave and without recourse to get help. And in this moment, domestic violence hotlines have seen a large decrease in calls, not because they are not in need, but because individuals do not feel safe to make those calls for help while they're at home with their assailant. And hospitals play a critical role in addressing the issue of sexual violence. Healthcare workers are often the first people to interact with a victim who has just been assaulted. And the partnerships between hospitals and rape crisis advocates are incredibly critical to getting survivors the support that they need. You know, I recently spoke with staff from Adventist Hospital who shared with me the severity and the number of trauma victims that they have seen come through their emergency room. And it has been higher during this pandemic, 1 month after the pandemic, than it had been during the entire pre-pandemic. And the work that they are doing on the front lines is literally life-saving work. And for this reason, on this proclamation today, I have invited Dan Cochran, the president of Shady Grove Medical Center, and Jessica Volz, the director of the Forensic Medical Unit, both from Adventist Hospital. And I would like to also thank Jessica Leslie from the Victim Services Advisory Board, who first brought this issue to our attention. And first I'm going to read the proclamation, and then I'll invite Mr. Cochran and Ms. Volz to say a few words. A proclamation of the Montgomery County Council. Whereas April was established as Sexual Assault Awareness Month to educate the public about harassment, abuse, and sexual assault. And whereas during this pandemic, many victims of harassment, abuse, and sexual assault have not disclosed their situation because they have been quarantining with their assailant. This is particularly true of school-aged girls who have been struggling in this moment between school and home responsibilities. And whereas sexual violence is a public health crisis that has lasting health, social, and economic impacts on the survivors and their communities. Every 73 seconds, someone is sexually assaulted in the United States. 1 out of every 5 women has been the victim of an attempted rape. 18% of cisgender women have been assaulted, and 21% of transgender, trans, queer, and non-conforming college students have been sexually assaulted. And whereas Montgomery County pauses today to give reverence to survivors of sexual violence and those who work to heal them, including the devoted staff of the Forensic Medical Unit at Adventist Healthcare Shady Grove Medical Center. Hospitals play a critical role in addressing sexual violence. Healthcare workers are often the first people to interact with a victim who has just been assaulted, and they are well positioned to identify a victim. The Adventist healthcare team dedicates their daily work to the most vulnerable individuals in our community by empowering and mobilizing them to share their stories and create a community free from sexual violence and abuse. Now, therefore, be it resolved that the County Council of Montgomery County, Maryland hereby recognizes Sexual Assault Awareness Month and affirms Montgomery County's commitment to the lives of survivors of sexual assault and all those who help them. Presented on this, the 20th day of April in the year 2021 by myself and Council President Tom Hucker. Mr. Cochran, I see that you and Ms. Volz are here, and I'd invite you both to say a few words.
Thank you, and good morning. My name is Dan Cochran. I serve as the president for Shady Grove Medical Center. Thank you, Councilman Gates, and thank you to the entire council for the recognition of this really unfortunate but important topic in our community. Shady Grove Medical Center is committed to taking care of these victims, and our forensic medical unit, specifically led by Jessica Volz, is key to that care. And at this point, I'd turn it over to Jessica for a few words.
Thank you. Thank you, Councilman Glass and esteemed colleagues. It's really an honor to be here today. As Mr. Cochran said, my name is Dr. Jessica Volz. I'm a nurse practitioner and the clinical director of the Forensic Medical Unit at Adventist Healthcare Shady Grove Medical Center. I want to thank you today for recognizing the important work of the forensic nurse examiners at Adventist Healthcare. They have worked diligently throughout the COVID-19 pandemic, often with much personal sacrifice, to ensure that services remained uninterrupted for victim survivors of sexual violence in Montgomery County. More importantly, thank you for taking the time today to shed light on one of our society's darkest topics, sexual violence. Your support and remembrance of the victims today will certainly make for a better tomorrow, and I deeply thank you for that.
Well, thank you both for everything that you do, and as we do come out of this pandemic and begin seeing each other again, this is something that my eyes have been opened to it, and through this conversation today, hopefully more people's eyes have been open to it, so that when we see abuse and we see victims, we get them the help that they need. So thank you for everything that you all do.
Thank you.
Mr. President, over to you.
Thank you so much for all of your good work for our residents. Thank you, Councilmember Glass. Now we will have a proclamation recognizing Arab American Heritage Month. As we all know, the Muslim community is absolutely integral to the fabric of our larger Montgomery County community and family. Muslim Americans are represented in every facet of life here in the county. Our small business leaders, our doctors, our lawyers, our engineers, and we're so deeply grateful for their many contributions every year, particularly in this holy month. And we're especially grateful to our Arab American community for their special contributions this year, providing emergency food assistance to families in need, contributing to our Medical Reserve Corps, helping with COVID testing and vaccinations, and for donating to so many nonprofits to help our diverse community get through the unprecedented crisis of the last 13 months. During this holy month of Ramadan, we are reminded of the ideals central to Islam, such as self-improvement, reflection, and helping those in need. All of our residents would benefit from taking those ideals very seriously this month and every month. Let me wish Ramadan Mubarak and turn it over to my colleague, Councilmember Will Jawando, for some brief remarks as well, and then we'll read the proclamation. Councilmember Jawando.
Thank you, Council President Hucker, and it's my honor to represent you too as one of your at-large council members as well. Ramadan Mubarak to everybody. It's great to be with you. This is a wonderful time of reflection, of assistance, of peace, as you heard from the Council President. It was my pleasure to join many of you over the weekend to commemorate and to honor the holy month of Ramadan here in Montgomery County with a proclamation. And it's also great here today to recognize Arab American Heritage Month. And we have such a strong diversity here in the county of so many people from around the world. And certainly our Arab American community has been a huge part of that. And so I want to thank you for everything that you continue to do, from testing to food distributions to lifting up the spiritual needs of our community. Go down the list. You're contributing in so many ways, and it's part of the great fabric that is Montgomery County. So happy Arab American Heritage Month, and look forward to reading this proclamation and hearing from some of you.
Terrific. Thank you, Councilmember Jawando. So I'll start off, we'll alternate paragraphs, and then we'll turn it over to Arwa and Samira, I believe, right? Okay, proclamation of the Montgomery County Council. Whereas April is National Arab American Heritage Month, which celebrates the Arab American heritage and culture and pays tribute to the contributions of Arab Americans. And
whereas Montgomery County is a welcoming community that is strengthened by the richness of skills, values, and knowledge within its multicultural community. And
whereas for more than a century, Arab Americans have been making valuable contributions to virtually every aspect of American society, including medicine, law, business, technology, government, and culture. And
whereas since migrating to the United States, men and women of Arab descent have shared their rich culture and traditions with neighbors and friends. And
whereas they brought with them to the United States their resilient family values, strong work ethic, dedication to education and diversity and faith and creed that has added great strength to our nation. And
whereas Montgomery County is celebrating Arab American Heritage Month with virtual events highlighting the culture, heritage, and achievements of our Arab American neighbors throughout the month.
Now, therefore, be it resolved that the County Council of Montgomery County, Maryland, hereby recognizes April 2021 as Arab American Heritage Month, presented this 20th day of April, the year 2021. Tom Hucker, Council President. Thank you all for joining us. Congratulations on the proclamation. Let me turn it over to Samira Hussein. Good morning.
Morning, assalamu alaikum, and thank you for the Ramadanic reading. I'm Samira Hussein. I am the proud founder of the Arab American Heritage Month that extended to be national. And on behalf of the Arab American community in Montgomery County and in the United States, we thank you for this and for joining us today. The culture of Arab Americans will be honored this month with designation by Montgomery County April as Arab American Heritage Month, reflecting the group contribution to the United States as old as America itself. Arab Americans served in the Revolutionary Army and helped this country achieve independence in 1776. Today, the United States is home more than 3.5 million. Well, I mean, this is the old census figure. American representing different, diverse array of different cultures and traditions. Like their fellow citizens, Americans of Arab heritage are very much a part of the fabric with this nation. And Arab Americans have contributed in every field, as our president mentioned. Like the Arab Americans poet Khalil Gibran, I like to quote him saying, "There are those who have little and give it all. These are the believers in life and the bounty of life, and those who give with joy, and that joy is their reward." Thank you, President Tom Hucker, and all the council members, and also our county executive, Mark Eldridge, for declaring this month as Arab American Heritage Month. This will give a community a sense of pride, and it is a chance to show that community is all about educate people and remove stereotypes. Thank you very much.
Thank you so much, Samira. Let me turn it over to Arwa Kadir with our Office of Community Partnerships.
Thank you, Mr. President, and good morning, everybody. On behalf of the Office of Community Partnerships and the Middle Eastern American Advisory Group, which is part of the Office of Community Partnership, it is with a profound gratitude I wish to thank the Council, the County Council, President, Vice President, and members, and the County Executive for, without their support and encouragement, inclusion of multicultural residents could not have been possible. So thank you so much for your continuous support. And happy Arab American Heritage Month to all our colleagues and community members. Thank you so much.
Happy Arab American Heritage Month, everyone. Thank you all so much for joining us. We're really grateful for all your contributions.
Good to see everybody. Thank you.
Thank you. And now we're on to our final proclamation recognizing Chesapeake Bay Week. Maryland Chesapeake Bay Week is a great reminder of the work we have ahead of us as we face a multitude of growing environmental threats. It's incredibly important that Maryland is a leader in addressing these threats, and as the largest county in Maryland, which is often on the forefront of environmental protections, Montgomery County has a very important role to play in this effort too. I'm happy to share with my colleagues that the ban on balloon releases that we passed at the request of many advocates in our county last year, in fact, helped push the General Assembly to follow our lead and ban balloon releases statewide during the 2021 legislative session. As you all know, the Bay is not only Maryland's most defining natural feature, it's central to Maryland's economy and responsible for thousands of jobs. Thanks to legislation we have passed at the local and state level, the Bay has been making progress, and that's been borne out in our crab and oyster population. But plenty of work lies still ahead as our Bay faces numerous threats, including the plans to expand 495 and 270, which have catastrophic stormwater implications as well as climate implications. I'm very grateful to be joined by advocates including Josh Kurtz, the Maryland Executive Director of the Chesapeake Bay Foundation, Jean Braha of the Stormwater Partners Network, and Sheldon Fishman, representing the Montgomery County Climate Action Coalition. These advocates are working every day to ensure we have a healthy and clean Bay. I hope you'll come back to join us in June when Council Members Katz and Rice will lead our county recognition of Chesapeake Bay Awareness Week. So with that, I'll first turn it over to Josh Kurtz, who will say a few words, and then to Sheldon Fishman. Josh?
Good morning, everyone. Thank you, Council President Hucker. It's great to be here. Thank you so much for this proclamation. As you said, the Bay is critically important to the state, and we are so thankful for the leadership in the county and for all the partners that are working here to really help us strive to achieve the blueprint, the Bay Blueprint that's going to be up in 2025. We know we've got a ways to go, but we need this continued strong leadership, these opportunities to educate the public, as you said. And I also just wanted to flag the importance of climate action for the Bay. We're seeing the climate change making this a far more difficult task than we thought to restore the Bay, and having advocates that are working in the climate space, working on the ground on stormwater issues in Montgomery County is critical to the success. So I want to thank you all for your leadership, for bringing such strong partners together, and for our continued efforts to really restore this incredible national treasure. So thank you.
Thank you so much. Jean?
Thank you, Councilmember Hucker. I'm delighted on behalf of the Stormwater Partners Network, but also in my day job as Executive Director of Rock Creek Conservancy to have this proclamation recognizing the Bay, as well as the wonderful watersheds within Montgomery County that feed into that. This is our second Earth Day during the pandemic, and I'm delighted that this one is causing me to break out my dress clothes a little bit more than last year. Which signals to a lot of progress ahead, for which we have great thanks to the Council for many of your efforts advocating to get us to that point. But it's also a great opportunity for us to reflect on what we've learned and gained appreciation for over the last year that we should really hold on to as we move back to whatever the new normal is. And I think that we have seen very clearly the contribution to quality of life that our waterways, our parklands, and our environment more broadly brings. So we're incredibly grateful to the Council for your leadership and support on a number of key issues, including, as has been mentioned, the proposed expansion to the Beltway in 270, the climate crisis, which is exacerbating all of these stormwater issues, which are just flushing pollution and sediments through our waterways and into the Bay. And we look forward to working with you and the rest of our elected officials to make sure that we have a brighter future ahead. Thank you.
Thank you. And Sheldon, welcome.
Thank you very much, and thank you for this proclamation. My name is Sheldon Fishman. We raised our 4 children from this home in Montgomery County. I am representing the Montgomery County Climate Action Plan Coalition and its over 25 members organizations, including the Chesapeake Climate Action Network, the Sierra Club, MoCo Students for Climate, Bethesda Green, Friends of Sligo Creek. That's not a background, that's the window onto Sligo Creek Parkway. The CAP Coalition appreciates and recognizes the Montgomery County Council as a leader in protecting the Chesapeake Bay. Our county is nationally recognized for our stormwater management practices, including a focus on green streets, stream restoration projects, and the use of rain gardens. For example, Bethesda Green has a rainscape project at Glen Wayne Gardens condos in Silver Spring, all of which help to protect the Chesapeake Bay. Montgomery County is also known for being a real leader in agricultural practices that protect the Chesapeake Bay. Every farmer in the county must have a nutrient management plan and that has dramatically reduced the amount of fertilizer used in croplands. Manure also must be managed, talking about real manure, that it does not reach into our streams. We also have a high percentage of farmers using cover crops which prevents erosion, and also stream buffers that protect streams with trees, shrubs, and grasses that lead to the Chesapeake Bay. Our county extension office helps each farmer develop a conservation plan, assist with technical guidance, and also help farmers and landowners get grants from local, state, and federal agencies to make those practices affordable. Your actions contribute to making the county a leader in bay-friendly agricultural practices. In summary, the preservation and restoration of the Chesapeake Bay is critical to the state and region's efforts to address the climate crisis. As a result, we thank President Hucker, Council members Abanez, Friedson, Glass, Jawando, Katz, Navarro, Rice, and Reamer for their leadership in supporting these initiatives in our county. Thank you very much.
Thank you, Sheldon. Thanks again to all of you. Without further ado, let me read the proclamation. Whereas Chesapeake Bay Week, held every April, is a celebration of the history, importance, and grandeur of the Chesapeake Bay, and a reminder of our work to maintain this national treasure. And whereas the Chesapeake Bay is the largest estuary in the United States, which supports more than 18 million people who live, work, and play within the watershed, and 10 million people who live along or near the bay's shores. And whereas the Chesapeake Bay was formed 12,000 years ago, when glaciers melted and flooded the Susquehanna River Valley, and is named after the Algonquin word Chesapeake, meaning Great Shellfish Bay. And whereas the Chesapeake Bay is a complex body of water that's deeply studied by the scientific community to reverse the degradation of water quality, which has contributed to the decline of the bay's living resources. And whereas we continue to work to ensure that Chesapeake Bay and its tributary rivers are free from toxic contaminants, have healthy oxygen levels, can serve as a valuable habitat for both terrestrial and aquatic life, and is in good overall health as measured by established water quality standards. Now, therefore, be it resolved that the County Council of Montgomery County, Maryland, hereby recognizes the week of April 18th to 24th as Chesapeake Bay Week, presented on the 20th day of April in the year of 2021, signed by myself. Thank you all so much for joining us, and more importantly, thank you all for your contributions to the Bay. I'm sure we'll see many of you in a couple days for Earth Day. Thank you so much.
Thank you.
All right, colleagues, despite having 3 proclamations, we're a little ahead of schedule. Madam Clerk, are we okay to begin?
Yes, Mr. President.
Well, now we will have general business. Madam Clerk, please share announcements, agenda changes, or petitions.
Good morning. We have one announcement. The council is seeking applicants to fill 3 seats for partial terms on the Public Election Fund Committee. The deadline to apply has been extended to April 26th, 2021 at 5 p.m. We also have an addition to the agenda added to the presentations, proclamation recognizing Chesapeake Bay Week by Council President Hucker. That is all, Mr. President.
Thank you so much, Madam Clerk. Madam Clerk has also distributed the minutes to council members for the meetings of January 12th, 19th, and 22nd, 2021. Are there any changes? Hearing no objection, the minutes are approved as submitted. Now the council will sit as the Board of Health. Dr. Gales and Dr. Stoddard, are you with us and ready to begin?
Mr. President, usually we're running 5 to 10 minutes late, so would not be at all surprised if they're surprised that we're about 5 minutes early.
Colleagues, we could adjourn till 9:35 if that's okay with everybody. Grab your second cup of coffee. You with us?
I'm here.
Hi, Dr. Stoddard.
Hello. Good morning.
Good morning. All right, gentlemen, now the council will sit as the Board of Health. We're looking forward to your update. Dr. Gales?
Good morning, everybody, and happy Tuesday. Before we delve into our pulse report, and hopefully I'll be able to share my screen shortly, I did want to provide a couple of updates. The first one, as you know, last Tuesday when we met, we were discussing the early ramifications of the decision to pause the use of the Johnson & Johnson vaccine. Since we last met, the Commission on Immunization Practices has met at least once to discuss those practices, and their recommendation was to gather further information before making any further determinations on the future usage of the vaccine. From my understanding, they will be meeting again on this upcoming Friday to review more information that they have hopefully gathered on the cases that have been reported. Since we met, there have not been, as has been publicly relayed, not been any other cases acknowledged that have been concerning for the clots that were detailed in those 6 cases that were referenced last week. Again, there's 6 cases out of 6.8 million doses administered. From my understanding and further calls with CDC and FDA, that the commission wanted to gather more evidence based upon the increase in the number of Johnson & Johnson doses used over the last 3 weeks. If you recall, the period of interest was 6 to 13 days following the administration of the dose, and they wanted to get more information to see if there were any other cases reported of that behavior. Again, as best as I know and as best has been shared publicly, there have not been any further cases documented. In the meantime, as we continue to wait for that guidance, the state has issued an updated set of guidelines and things to watch for, or through the Board of Physicians and through providers for any of their patients or clients who may have received the Johnson & Johnson vaccine. So that said, there are no further updates related to that. We do eagerly await the ACIP's next meeting on Friday to see if we will get any further recommendations about how to move forward. Now, as a result of that, we did see some reductions in doses across the county. The local health department doses stayed the same this week they were cut from 10,000 to 7,000 last week. We were updated on Friday that this week's allotment will stay at 7,020 doses. They will be Pfizer doses. The state mass vac site that is in Germantown did see a reduction of its doses from 5,800 to 4,800 for this upcoming week's allocation, and they will be Pfizer doses as well. The second thing I wanted to put out there is that the state yesterday released new guidelines for schools to follow related to recommendations for distancing practices, as well as updated guidelines related to isolation and quarantine practices for individuals who are non-vaccinated, as well as those who have been vaccinated, to be consistent with or as close as possible to the most up-to-date CDC guidelines. That information has been shared with our colleagues at MCPS and discussed in terms of implementing those new guidelines now that they have been released into the school procedures and processes. So I will share my screen here. Give me 1 second. My screen is not coming up. Sorry, apologies. One second. Okay. So hopefully you're seeing a PowerPoint presentation. Yes?
Yes.
Okay. All right. So this is our update with our most recent vaccination and transmission numbers. Again, when we talk about community transmission, here we see that our Case rate continues to hold steady. So it's actually at 9.8 as of yesterday. It's important to note that our case rate is actually I think it was 22nd or 23rd in the state yesterday. Our test positivity continues to be lower than the states as well, in the same area of 22nd or 23rd. We continue to monitor the hospitalization rate, both in terms of acute hospitalizations as well as intensive care hospitalizations, and those numbers have plateaued a bit. When we look at our vaccination numbers, we've now achieved 46% of our residents, which is equivalent to 485,000 residents who've received at least one dose. And 29% of our residents, or approximately 300,000 of our residents, have been fully vaccinated. And when you look at that compared to other jurisdictions, we rank third in the state in terms of the percentage of our population having received at least one dose. Of note, when we break it down by age, you can see that our 75 and up group, we now have 74% of those folks fully vaccinated, with 83% having received at least one shot. And our 65 and up group, 68% of those fully vaccinated, and 83% having had at least one shot. Now, that makes sense given that the initial prioritization was focused on age, but we do hope that as we continue to move forward, and now that everyone over 16 is eligible to be vaccinated, that we'll start to see these numbers increase. And just as a reminder, Pfizer has requested an EUA evaluation for the use of their vaccine candidate down to the age of 12. And the FDA hearing is pending on that. This just shows how many doses we've administered over time in terms of, the county government operations. So of that 400,000+ doses that have been administered, 177,000 of those doses have been administered through county operations. And when you break that down, here's a schematic that shows you where those doses have been administered, and the government piece as well as the mass vac site continue to be the two largest places where doses are being administered throughout the county. Here just breaks down our distribution by week, by age, and as you can see, the percentage of those in our older groups are decreasing again as they get up to higher percentages of those covered. And you see the relative vaccination rates by race and ethnicity are increasing for all of our groups, and the gaps between them are shrinking as well as we continue to move forward and increase access to the vaccine across all different age groups. Now, certainly we will continue to monitor these gaps and attempt to address this with our continued equity strategy that prioritizes those high volume zip codes based upon those who've been hit the hardest. We also are going to attempt to go through and look at from a geographic standpoint where we see the lowest rates of uptake of the vaccine and try and work hard to make sure we factor that in as well as we continue to come up with strategies to address equity in our allocation of doses. This is our map that shows the geographic distribution of where the doses are. The darker greens are those that mean higher percentages of those over 65 vaccinated. The lighter colors show, a lower percentage. But overall in the county, again, we've got 83% of our population who's over 65 having received at least one dose, and 74% of those over 75 fully vaccinated, and 68% of those 65 to 74 who are fully vaccinated. And this is our map that we've got to do some work on, obviously, as the age eligibility has increased to those under 65. And so you see we've got some significant pockets there where we do see lower vaccine rates compared to others. This mirrors where we were in the early stages of vaccine allocation and distribution. And we will, again, continue to utilize our equity strategy to address those zip codes that have lower uptake that unfortunately also match up with some of our priority zip codes in terms of those who've been hit the hardest by COVID. And then this just breaks it down by vaccination, the percentage who have received a first dose over with the overlaying of the percentage of those who've been fully vaccinated. Pre-registration, we continue to encourage folks to get pre-registered within our system so that we've got your information. We as a county have not moved to an on-site registration walk-up process just yet. And Dr. Stoddard can comment further, but if I recall correctly in a meeting that we had yesterday talking about this, we still have approximately 120,000 individuals who have pre-registered who were working to get appointment slots. So unlike some other jurisdictions where the supply of doses has outstripped the demand, we are still in a situation where the number of doses we have available doesn't fully match up to the number of individuals who have requested vaccine appointments. This is just a reminder of our updated priority zip codes based upon our equity framework. There's not been, this map has unfortunately been fairly static throughout most of our vaccine allocation and distribution process. And then this just breaks down the percentage. This is the county population by age and by race and ethnicity, which underscores, again, the work based upon some of those geographic representations earlier that we need to do with these younger age groups in terms of making sure that folks are pre-registered, they're getting good quality information related to the vaccine, and that we're seeing them get shots into their arms. I will stop there. It's the conclusion of the presentation. Happy to answer any questions. Turn the floor over to Dr. Stoddard.
Good morning. I just want to add a few things on to what Dr. Gale said. So we do have 126,000 roughly individuals in the pre-registration list. Of those, 79,007 have already received at least one invitation and will receive multiple initial opportunities. And 47,537 have yet to receive an invitation. Obviously, this, we're adding we're down to adding about 650 to 700 new pre-registrants each day. But obviously, we're scheduling many more than that for appointments each day. And so we are working our way through the list. I think as I alluded to yesterday in the council meeting briefing, is I think we're probably 3-4 weeks away from getting through this list at the current rates, assuming we don't see any massive influx or massive reduction in doses. And so we have had conversations with the state about how mass vaccination sites around the state have utilized walk-up opportunities. They have generally agreed with our assessment that we will let the behavior of our residents in coming in and filling up appointments dictate how quickly we move through to another phase where we do something other than pre-registration. And so we know that will increase accessibility eventually, but obviously, as Dr. Gales alluded to, we've got a lot of people who are still waiting for an opportunity that we do not want to pass by. We did new work with MCPS. We met with them yesterday and discussed all the challenges that they face. We're in the process of scheduling a similar meeting for non-public schools. With MCPS yesterday, they talked a little bit about the graduation planning that you all will be taking up as Board of Health later this morning. There were only a couple schools that I think had any sort of challenges with the guidelines, largely because their stadiums are smaller than they probably should be given the size of the schools themselves. And so they'll be working through some challenges there and sharing those plans with us for us to work jointly with them to develop those graduation plans. I think as Dr. Gales has previously alluded to, working on including vaccination rates in our future guidelines for how things can move forward to reopening. Obviously, that's going to be an important part of overall keeping the public engaged with us throughout this whole process, is to show them that as we get more vaccination rates, things will get better. And obviously, we want to encourage people who are on the fence about it, that getting vaccinated is in the best interest of them and their community. The last thing I'll talk about is the CCC teams, the COVID community teams. They've got events scheduled, and we're going to look to develop a weekly report where we talk about the materials they distribute, the events they hold, the quote unquote doors they knock on over time. So that's something that we're working on actively developing, is to be able to show all of that work. But in summary, they've done more than they either have done or have scheduled over the next couple of weeks more than 50 events since the beginning of March to try and encourage people to get pre-registered. And candidly, when we see events of pre-registration, we do see spikes in our pre-registration incoming, which is exactly what you want to see, is that people are hearing the message when we get out there and talk to them. And we do see more people thinking about getting pre-registered in advance. So I think those are all the things on my list that I wanted to highlight. I'm not sure if there's anyone else to provide an update. Otherwise, we'll take questions.
Thank you. Dr. Bridgers, anything to add?
Good morning, Council President Hucker. Nothing to add from me this morning. I'll just add if anything comes up to the Q&A session.
Terrific. Thank you. Okay, Councilmember Reamer.
Thank you. Nice to see everyone. Couple things I wanted to take through. If I could ask for a bit more, Dr. Gales, you mentioned that the state has provided guidance on the 3 feet distance. Could you please just expand on that? Where can we see that? I'm just very interested to see how that gets implemented. I have to say my youngest son did a lot better with school when he was back in the class. It was quite a relief for the family to be able to have him do his work at school rather than constantly fighting with him to get it done. And he's a good student, but personal story here about the value of being back in person. Could you please share a bit more about just the process, and is it guidance? Does the board need to vote on it? What can you share about that, please?
Thank you, Councilmember Rimmer, for your question. I can send you all a link to the most up-to-date guidance that they provided that goes into further detail. I think it was first presented last Thursday in a seminar or webinar to schools, and then presented to health officers on yesterday. I would say this, so again, obviously we all do think that kids do perform better.
I'm having a little trouble hearing you, Dr. Gales.
Can you hear me now?
I think so.
Is it better?
That's fine.
Okay. All right. So I again, thank you for your question. So I don't think there's any denying that children do perform better in person. Again, I think that any of the metrics put forward continue to promote safety and making sure that they can do so in an environment where, safety precautions are put into place. I will be happy to provide you with the link to the up-to-date guidelines. It is not something that the Board of Health needs to vote on. It's something, the guidelines have been provided from the state for the school systems to be able to follow. And consistent with the previous conversations with CDC around those physical distancing guidelines, not much has changed from that beginning. They were specific to elementary schools and not applying to some of the older categories. And the 3-foot rule still applies to the classroom setting. It does not apply to all of the other places within which the children will interact in the school, and still does impact capacity. So even though 3-foot distancing is allowed in terms of classrooms, if a case were to pop up, a high-risk contact is still considered anyone who is within 6 feet of distance in comparison to the rest. So I will be happy to send you the link to those most up-to-date guidelines. It also, in addition to the physical distancing piece, does provide some clarification around who needs to quarantine, how long they would need to quarantine, particularly those who have been vaccinated, plus minus whether or not they have symptoms.
Thank you. Just a quick comment. I read the CDC guidance on the 3-foot distancing, and it did apply to middle and high school, but there are conditions about the level of transmission in the community, and you're not supposed to do it when you're at the highest level, which fortunately we're not. So
the more challenging portion of those guidelines is the cohorting.
Okay.
In middle and high schools, typically you move between classrooms to have music class or art class. It's not, the guidelines are not intended for classrooms where you're switching throughout the day. They're intended for cohorted classrooms, meaning you are in the same room with the same students for the duration of the day.
Okay.
So the problem for MCPS is obviously that their middle schools and high schools move to do for different classes. You have math class, you have social studies, etc.
I just want to know what the process. Thank you.
Yeah.
I was just trying to understand. It was news, welcome news that the state has issued its guidance that flows down to MCPS and then the Board of Education, not the Board of Health. Board of Education may make some decisions there, but that is between MCPS and the state. So I'm eager to see that. Quick comment on the graduations. I think it's just worth remembering that graduation ceremonies will be taking place in June. And by the time June comes around, I think it's reasonable to expect the conditions should be a lot better in the county. So I certainly encourage you to work on the waivers and to grant them. Kids need to graduate. They need to have the ceremony. Let the senior class be together at least once this year. I'd like to know what the latest is on the libraries. I continue to believe they should be open now. We got restaurants open. Why can't we have libraries open? What's the latest there, please?
I have an updated timeline. I do know that I think we're going to be talking about something this week about a timeline, but that was the last update I had was on Friday. So I know that they're actively engaged with the library staff and obviously having to de-entangle them from the COVID testing and other activities that they have been doing in support of public health and some of the other COVID missions, Food Access Call Center, for example. So I do think there will be an announcement about that later this week. And as we alluded to previously, we will inform the council prior to making the public announcement.
Okay. What about baby pools? Is there a reason that baby pools are not allowed in the they're shut down in our pool guidance?
Councilman Rumor, I don't know specifically about that. We can have a conversation
That'd be
about
great.
this further.
Thanks. That's enough. Thanks. Just wanted to flag that. I've been asked by some parents, and it did make sense to me. That might be something.
Yeah, I just so you know, I saw that in their guidelines the other day, and we meet on Wednesday mornings, and so that was one of the things I planned to bring up. Same applies to hot tubs and other water effects, not just wading pools and things like that. So we'll take
final two. I'm sorry, I'm just trying to tick through everything. Final two things. First of all, are we going door to door signing people up for vaccination appointments yet? And then secondly, in a very general way, I appreciate Dr. Gales, you shared with us the Illinois metric framework. I think it's a good one. And I think we ought to adopt something like that so that we can have a lot of public clarity and transparency about what the phasing is back to normalcy. So I know you're working on that. I just want to encourage that and hope that we could put something in place sooner rather than later. But could you please talk, maybe whichever doctor, are we doing door-to-door signups yet for appointments?
CCC teams at this point are going door to door, but they're leaving materials, not necessarily doing in-person signups. We had a discussion about this on Monday, and there are still some volunteers. There's still some volunteers who are doing the door-to-door drop-offs who have not been vaccinated, which was something we just found out about. So I'm working with Mr. Hartman to try and schedule those people who are volunteered to do those, so they can actually do those engagements. But that's something that the CCC team. I don't know all the details about what they're working on.
Thank you. I think it would be great for us to have a report, weekly, maybe, about how many appointments we've been able to sign up through that technique. So thank you.
Thank you. Council Vice President Albornoz.
Thank you for the updates and continued hard work. A couple questions. So, fingers crossed that the federal government will once again approve the Johnson & Johnson to be readmitted. Dr. Fauci, I know, was on media over the weekend stating that he thought by Friday there would be a decision. And let me just say publicly, if the Johnson & Johnson vaccine were to be made available, I would take it because I would feel confident. But we have to also expect the practical reality that there are some that may not. Now, we are in a position to not yet have folks be able to decide whether they take the Moderna, the Pfizer, or the Johnson & Johnson. Have there been any discussions or provisions for people who, for whatever reason, choose to take the vaccine but would prefer not to take the Johnson & Johnson? Has there been any discussion on how to handle situations like that?
Well, thank you, Councilmember Alvarez, for your question. We did discuss that in the early stages of the vaccine process when we knew that there would be multiple doses. As it relates specifically now, I think we're in a holding pattern until we get further guidance in terms of how if Johnson & Johnson will still be used, if it will be fully used, if there will be contraindications for certain populations within it. But yeah, so that has been discussed to some degree, but in large part, a lot of that is contingent upon what ultimately will be decided. We have also, as part of the health officer group, had some initial discussions and, with the state on that in terms of what direction they may take, pending the final recommendation, but recognizing that there is potential anxiety to come with some folks related to the doses.
I would also add, we've been dealing with this for a little bit since the beginning, in the sense that some people have always preferred one vaccine over the other. And typically when their appointments are made, they're informed of what vaccine they'll be receiving, so they can make a choices to accept the invitation or not accept the invitation based on the vaccine. In rare cases, like last Tuesday when we had to switch from Johnson & Johnson to Pfizer, there is a process that has been utilized on site because the consent form is actually based on the vaccine you receive. And so, when we had to swap consent forms, we had to explain to people you're going to get the Pfizer vaccine instead of the Johnson & Johnson. And some people, choose to say, no, I don't want to, or the vast majority of people say, I take whichever vaccine you receive. But typically we prefer to do it before they get to the site. So obviously they'll know you're getting this vaccine. If you don't want to get that vaccine, then, it's not like we have all the vaccines at all the sites. So we're not typically just, you get there and you pick what you want to have. It's you come to the clinic, it's going to have that clinic's going to be Johnson & Johnson clinic. So if you don't want that vaccine, you're not coming to that clinic.
That's helpful. And is that true of this? That's true of the state mass vaccination sites as well, right? Not just ours?
Yes.
Okay, great. That's helpful. Next question is, so, now the great news is so many people are getting vaccinated now, over 83% over the age of 65. People that have remained registered through our system, should we encourage them to unregister to help make sure that we streamline and make things a little bit more efficient? Or does that not really make a difference because once they receive the advance notification that they're eligible for it, they can just choose not to reply and then it goes back in the queue? Or would we prefer to encourage people to unregister so we can keep things moving?
We've given people a modality to unregister, but the reality is we're using the state's Immunet data to deconflict our own pre-registration list, meaning if you've been vaccinated anywhere in the state of Maryland, you go up into the state Immunet system. So if you go to a mass vaccination site, a pharmacy, a hospital, what have you, the data goes into Immunet, and we actually use that to pare down our pre-registration list every week. So that way we know if you've been offered an opportunity within the state of Maryland. If you got vaccinated somewhere else, then you want to remove yourself from pre-registered in Montgomery County, there is a mechanism to do that on the website, and it's quite straightforward. So
okay,
people can do if they want to, not necessary.
Okay, should we encourage people to do it, or it doesn't make a big difference?
It's more about people feel the need to because they want to make sure that they're not slowing people down. We want to give them a mechanism to do that. But the reality is we're doing it on the back end regardless because we can't count on everyone doing it anyway.
Okay. Thank you. I appreciate that. A couple people have asked, wanted to make sure. And final question is, obviously the great news is everyone can pre-register, but there is some evidence nationally that the youngest demographic eligible is not pre-registering at the same rate as adults. Not a surprise, right? We were all 16 once, felt invincible. And for a variety of reasons, this may not be the highest priority for somebody who's a teenager or in their early 20s. Are we seeing any of that same evidence of folks not pre-registering at the same rate as older age groups, or is it tracking better here? And if it is similar to what's tracking at the national level, what efforts are we taking to encourage younger populations who are now eligible to pre-register to pre-register?
I can say this: that phenomena is happening across the state. Again, as the health officers, we've been talking about it since last week, kind of in our listserv, and trying to come up with some best practices around how to rally the troops in that age group. I think that, just as an aside, if you all checked your emails, I forwarded you all the information for Councilmember Reamer's request related to the school guidelines, so you should have that in your inboxes. But it also speaks to, as Dr. Stoddard mentioned, we met with MCPS on yesterday to talk about or engage around, or at least begin a conversation around, some potential strategies to engage young folks, as well as discuss, as capacity of doses increases, hopefully in the future, opportunities to be able to provide vaccines to the 16 and up group. I anticipate by the time we reach that point, potentially at least one of the vaccines will be approved down to age 12 by then, hopefully, and increase the scope. I think we, much in the same way that we have taken the approaches to try to get different communities based upon race and ethnicity and geography pre-registered, we've got to do some homework around engaging young folk, potentially utilizing youth ambassadors and young people who speak young people.
Yes.
Yes, young people who speak young people or teenage. As much as I'd like to, it's been a while since I've been 16. So, making sure that we find, much like, again, in the approach that we've taken so far, community champions who have good outreach in the community, who are trusted and can translate the importance of getting vaccinated in a way that resonates with that particular community.
On that point too, we're actually bringing some of our COVID tour volunteers who are younger people typically to help with the vaccination effort as well, to help us with communicating to younger people, as well as working, volunteering at some of the sites, doing outdoor, sort of line management, things like that, to engage with our young people so that they can be ambassadors for getting other young people to pre-register.
Yeah, I would just suggest, I love the thinking. So there's a really strong infrastructure in place of organizations that are youth-led to fight against vaping, to fight against tobacco use, to fight against underage drinking. That same infrastructure, which is really effective and very effective on social media, could be used to promote taking the vaccine. And so I'd love to follow up with both of you. And I know a number of my colleagues are engaged in youth development work as well, and personally and professionally interested in that subject. So now that we're in a better place and you can pre-register, would love to follow up on talking about strategy and engaging our youth. So thank you both so much for your continued leadership. Mr. President, I yield back to you.
Thank you, Council Vice President. Just to follow up on that, if I didn't hear this answer, and it's on my list. Has MCPS sent out any notification to students to get vaccinated, and will the rec department send out an invitation to parents and youth on their list?
I'm not sure. I can't speak to. I'm not sure. We can follow up with them to check with them, but I don't believe they have. At least I don't believe MCPS has. I'm not sure though.
Mm-hmm. Thanks, Councilmember Navarro.
Thank you, Mr. President. Well, first, I want to thank all of you for participating in last Wednesday's Government Operation and HHS Joint Committee, where we did discuss the efforts that are underway in terms of addressing a lot of the equity issues, and very impressed by what the different initiatives are doing. The African American Health Program, the Por Nuestra Salud y Bienestar, the Latino Targeted COVID-19 initiative, as well as the complaint count that now is going, has shifted under the leadership of Diane Vu, as it was referenced, regarding how to begin to go really deep into the communities and apply some of those strategies that were applied during the census. And so I was very impressed and truly amazing the work that is taking place. So with that, I was pleased to hear that the relative vaccination rates are better now for our communities of color. We're seeing some progress, yet when we look at the map, we still, I noticed that we continue to grapple with those particular areas of the county that we consistently have identified as having disproportionate impacts from the very beginning. And so I'm curious, from your perspective, knowing that yes, there are particular plans that are being executed in those areas as it was shared during this joint committee. But as you can, I'm sure appreciate, we still grapple with those areas of the county continuing to be a challenge. Can you share a little bit about where you see this going? What is your assessment? In terms of the particular strategies that are going to be targeted, what do you think would be a timeline where we might begin to see some accelerated progress? I continue to be concerned because it is quite a large area, and again, has been consistent from the very beginning. So what is your assessment, given these initiatives and these strategies, of when we can start to appreciate some significant progress there?
Thank you, Councilmember Navarro, for your question and observation. I think that we have seen some movement already in those areas. Now, to do an even deeper dive, to get to closing that gap even more, I think part of that will, at least one of the strategies that I'm most excited about, our team is most excited about, is being able to continue to work with our community partners who have more of a footprint in those respective areas, both in terms of the work that they've done historically, but also in terms of being able to reach out to different, community groups and have a diverse set of offerings in terms of how the vaccines are distributed. So this week, and I failed to include this in my opening comments, as you know, historically throughout vaccine distribution, we have provided different groups vaccines to be able to go out in the community and however they choose, whether it's through homebound vaccination, pop-up vaccination, we've given them the flexibility to be able to use that to leverage those relationships. And this week we've got, I believe, I'm looking at Dr. Bridges on the screen to confirm the number, over 1,200 doses that we are providing to different groups that we've trained to be able to do that. We are hopeful that as the vaccine capacity increases, hopefully comes back to a higher clip than where we are right now, we'll be able to provide even more doses to those groups to be able to be flexible and nimble in terms of the different styles and strategies to do that. For example, I know that to the earlier question around being able to get folks registered and set up for the vaccine, I know the one group in particular is going to some of the social support venues where we're linking families to social support needs and food and things like that, to register folks, not for that day, but to sign folks up there for a clinic the next day to then be able to do it. And I know, and that's, I won't say, I know they're still working on that platform, so I won't say who that is. And I know another clinic who has already been, CCACC has been having clinics at the Pan Asian Clinic, and Care for Your Health has also been doing a multiple array, whether it's homebound as well as going out to venues and meeting people where they are in the community to make it as low barrier access as possible. I think that's one set of strategies there that I think will help get increased penetration within those priority zip codes that will be able to meet people where they are, more so than we as the larger operation being able to try to scale these larger venues up and have people come in.
So, Councilmember Navarro, just to add to that, I know the last couple of weeks I've been pushing testing, along with vaccinations, and we can't get away from that. And so, as part of our strategic platform and portfolio, we have increased those rapid tests to our community partners. So, as part of the vaccination effort, when they go in these spaces, they have the BioNet rapid test available for them to use to not only to test those individuals because they may or may not be sure as to whether or not they are symptomatic or asymptomatic, we've made these BiNet rapid test kits available. Much of the conversation, especially this morning and yesterday, as far as pharmacies making these rapid tests available, these in-home test kits, but we've made them available prior to actually these pharmacies announcing that these test kits will be sold over the counter. We've made them available to our partners, our community partners, so that they can also test as well as vaccinate more folks. And so that's part of our strategic initiative. And I will repeat that until we get more folks vaccinated, we need to have them tested as well so that they can know their status and either isolate or quarantine so that we can suppress any further risk of transmission in the community.
Thank you. This kind of very targeted approach, it's so powerful because, as we all know, word of mouth is one of the best ways that information gets shared. And we know that anytime there are these, successful different initiatives going on in these communities and very targeted communities, then very quickly the word spreads, and that helps amplify what we're all trying to do here. I'll share two anecdotes. The very first test that I got was a Proyecto Salud, and while I was in line, I could hear in Spanish people calling other people saying, "No, you got to come. You got to come. It's very easy. It's and you could see sort of like that communication occurring, sharing the positive experience. And just yesterday, I received a call in Spanish from Proyecto Salud, someone saying, "I know that you've been tested here before, want to share with you other services that we have and that we still, that we have tests available." And I said, "Well, thank you very much for the call. I'm Councilmember Navarro, and I'm really, really familiar with what you're doing, and thank you for calling." But my point is that there's just so much going on in the community that perhaps we don't get to see right away. But I am convinced that if we keep steadily increasing these types of initiatives and these types of efforts, it's going to snowball. And very quickly, I think we're going to see some extraordinary numbers and things shifting. So really want to appreciate and recognize the extraordinary work of all of these folks out there, because they have been steady and they continue to step up and they continue to respond anytime that we say, "Can you do this other thing?" They're there to do so. So thank you all for that. And also, again, shout out to all those community folks out there.
Thank you. Councilmember Katz.
Thank you very much, Mr. President. And thank you once again to all who are doing all of this necessary work. You're doing a great job. Dr. Gales, you mentioned earlier on about the Pfizer doses and what we'd be receiving. But I think we need to be clear, if someone got a Moderna dose as the first dose 4 weeks ago or 3 weeks ago, and if they come to one of our sites, they will need to get Moderna, and we would have Moderna. Is that accurate?
Yes, and I apologize again. I have to slap my hand on this because I said I would clarify the last. I think we had the same conversation 2 weeks ago. So when we're talking about the doses that we're receiving from the state, there's two tranches of doses. There's the first doses and second doses. So when we say we got 7,000 doses this week, that's referring to first doses. So to Councilmember Katz's point, I want to make sure everybody at home understands is that whatever shot you got first will be the second dose that you get. So if you got Moderna first as your first shot, you will get a Moderna dose as a second shot. And the way the doses are sent to us, the second doses are based upon the first doses that we did 3 weeks or 4 weeks ago. So if whatever you got as your first shot, we will have that second dose available for you that was specific to that. And when we again, just to clarify, when we're throwing out saying, we're getting X amount of doses each week, that's referring specifically to those first doses. But we get a comparable amount of doses, second doses, based upon what we did a month prior in terms of distributing those first doses from that time period.
And Dr. Gales, believe me, you should not ever smack yourself on the hand. You do a great job of communicating, but but I just wanted to be clear for anyone that gets concerned. Thank you. And I know that all of us have been getting this, and wanted to be just put it on it literally on our radar. But we're coming up to the time. I guess every month is a time for weddings, but especially the May, June, July time frame, and we're getting inquiries as to if a restaurant is allowed more than fill in the blank 50 people. Why could someone not have a wedding if they did the same thing that restaurants are doing? Is for safety. Why couldn't they have more than 50 people or whatever the number would be at their wedding? Are we looking into that? Are we doing something about that? Where are we on that?
Well, I would say, just again, strictly from the public health side of things, as we discussed briefly before, we're looking to update guidelines that is inclusive of all of the different community transmission factors, hospital numbers, as well as vaccine numbers. And hopefully, as you know, we've been studying and looking at other jurisdictions who've implemented those strategies. I think that hopefully we'll be able to share that with you all very soon to be able to think through some strategies to say, if we hit these targets, here's the number of folks that could be, expanded to in terms of capacity to meet those needs. And lots of folks say, well, we're here now, well, June will be much better. Well, we don't know that. It's very fluid. And so what we're trying to be careful about, particularly in a setting where the rest of the state is seeing much higher numbers, we're seeing higher cases of variants, we want to continue to make sure that our numbers hold steady and we don't see a comparable increase of that. Because if we do reopen things, we don't want to have to potentially be in a situation where we would see higher numbers that would cause us to have to consider walking things back. So that's a long answer, well, hopefully not too long, to say for the folks at home, again, watching, is we're thinking through how to update and make those reopening criteria more relevant, given particularly given the percentage of those who are vaccinated, to be able to potentially expand reopening criteria in a safe way. Now, I think it was Councilmember Reamer or Councilmember Albanos did reference in past conversations. We had shared that one state who had done that so far is Illinois, in terms of breaking down the phases of reopening based upon community transmission levels as well as vaccine numbers. And that's probably the best example, at least that I know of, that I've looked at and studied and tried to break down. It will be challenging for us, given that the state has not taken that approach and we can only control so much within our area. But I do think it's something that hopefully we'll be able to provide something for you all to take a look at and consider that would be able to hopefully simplify the process and give folks a sense of where we would need to be to expand that level, less so in terms of a timeline, in terms of being able to predict.
Okay. Thank you. And then the last thing I did want to mention, and Councilmember Navarro was talking about the in-home test kits. I did see, I think it was on the news this morning or last night or whatever. You don't remember exactly when you see something. But one of the things that they did mention was that some of these test kits are, have expense to them, $40 and up, and that they are not covered by insurance. So if you get it from a pharmacy. So I do think people should be aware that there are tests that are available that you can purchase on your own, but there's also the test, as you were mentioning earlier, that we are still providing, and that you don't have to purchase them on your own if that's what you want. So with that, thank you all again for everything you're doing. You do remarkable work, and we all are most appreciative. And Mr. President, I'm turning it back over to you.
Hear, hear. I second all your comments. Councilmember Glass.
Good morning. Thank you, Mr. President. And I will third those comments as well. And, again, just reiterating the encouraging news that 29% of residents have been fully vaccinated and 46% have received at least one dose. So we are working through this. and the trend lines with regard to getting people healthy and safe are increasing. So good job. Thank you, everybody. Councilmember Katz was just asking about in-home testing, and along those lines, I want to follow up on a question that I've been asking over the last number of weeks, and it was about in-home vaccination. And I know that we've been talking about a pilot program, and I think now DC is starting those efforts, and I'm receiving more and more correspondence, as I know my colleagues are, because as one or multiple members of a family are getting vaccinated, and then the homebound family member remains unvaccinated, people are starting to get concerned. And so can you provide us an update as to how that pilot program is going?
Thank you, Councilmember Glass. So I guess at this point, we're months into the vaccine distribution process, so I don't think we can call it a pilot anymore. So there's a couple different components to it, and Dr. Bridgers can chime in as well on this as he's worked closely with the team. One of the clinical partners that we referenced earlier in one of the questions have been doing homebound testing, and so we did start off with 100 doses for them to do that process. They have been getting more doses each week as time has moved forward, and they are doing a combination of homebound vaccination as well as community pop-up vaccine sites within that. We are hopefully finalizing details with one of our partners who we have used to do homebound testing throughout the pandemic to be able to provide homebound vaccination. And in addition to that, one of the things that we're excited about being able to provide doses to community partners is that they also will be able to leverage their resources to do some of those types of things in terms of homebound testing to address that. I believe the most recent information that we had was that we had approximately 1,200, maybe 12 or 1,300.
Down to 632.
Okay, well, I'm saying, so we had that many folks who had pre-registered saying that they were homebound, and we had vaccinated over half of those folks. Over 630 of those people had received a vaccine, and we continue to chip away at that list. And that was as of last week. We'll have to go back and see what the most recent numbers are on that one.
Well, I'm glad to hear that.
Councilmember Glass, if I may just add to it.
Please.
So part of that initiative to reach our homebound individuals include the state support and the FEMA strike teams, if you will. Dr. Gales, in his conversation with the Maryland Department of Health and FEMA, as a follow-up conversation, we had the team scheduled to come out last week, I believe, but they've only been trained to administer the Johnson & Johnson dose and couldn't administer the Moderna and Pfizer dose. As part of that. Now, the last piece I wanted to add is that as we identify those pre-registrants or individuals who've been identified or self-reported as being homebound, we've also looked across county lines. So those individuals who may work or have individuals who reside in other parts or in other counties who may have self-reported or being caregivers of homebounds, we partner with our other local health departments to identify those individuals and to ensure that they get vaccinated or get vaccinated in those home of records. So we also want to vaccinate those caregivers of individuals who self-reported as being homebound. So those are some of the strategies, and we continue to monitor those. As Dr. Gales indicated and Dr. Stoddard indicated, we windowed the list down to 45, then it went back up as we open up registration, and we continue to monitor those and look for those duplicate individuals who may be in the system or who may have live outside the county but report some way that they are homebound in Montgomery County to get vaccinated. So all of those strategies are into play now so that we can target those individuals who reside in Montgomery County who don't have access to vaccines and to get them vaccinated.
I appreciate you talking about the technical logistics, Dr. Bridgers, because I just want to follow up on that. Based on the conversations that we've had in this public space, it had been suggested that people register, and they register on the county website. And so, Dr. Bridgers, the list that we have, is that for just the people who've registered on our system, or are we also culling the list from the state vaccination site? And I'll say that I think some people have gotten confused, right? Because a pre-registration is a pre-registration, particularly when they all look somewhat similar.
And so Dr. Starter can correct me if I'm incorrect, but we focus on those individuals who have self-reported and self-registered on our system, our county system, as being homebound.
Okay, very good. And I think yeah, go ahead.
Yeah, just so we're clear, the state's pre-registration system, you're actually pre-registering to come to a particular location. And so they wouldn't even, I don't even think their database even ask the question of homebound, because you're part of the process is identifying who can come to the mass vac site. It's not a statewide pre-registration, it's a mass vaccination registration system, for lack of a better description.
Excellent, thank you. And then the last question I have, you're saying that the county is doing some of this coordination with our community-based clinics or outreach groups, whoever's going into the communities. I know that I had connected some of you with some folks from the state who are looking to expand to some homebound vaccination programs as well. Have we made any headway with the state? Are they helping these efforts in any way?
Well, Dr. Bridges actually referenced one of those groups. So there's multiple groups. There's a group from the feds with FEMA. There's some strike teams coming from the state. We've worked to coordinate with those as best as possible so that there's no duplication in terms of efforts. And as you mentioned, for example, the mobile strike team that had reached out to us through FEMA actually is at the time is only trained to do the Johnson & Johnson doses. So they've had to go back to the drawing board and look at how they could potentially increase the training for their staff when those others, and not only training and administration, but also, for example, with the Pfizer vaccine, there is a reconstitution process that requires a little bit more effort than just administering the dose. And so making sure that they would have the capacity to be able to do that in the field, or, have those logistics figured out in order to administer.
Well, thank you for shedding some light into the logistical hurdles that it takes to put this one little program together on top of everything else that you're doing. But it is good to hear that at least half of the individuals who have signed up pre-registered through the county have gotten homebound vaccinations, and we're going to work through that list. So I will share that with the constituents and remind them also to pre-register with the county vaccination site. So thank you all for your work and for the updates.
Thank you. Councilmember Rice.
Thank you very much. So let me just jump in. Dr. Gales, Dr. Stoddard, Dr. Bridgers, when it comes to our 16-year-olds, obviously that are minors and will need parents' permission to be able to get vaccinated, do they have to be present with them to get the vaccination, or do they just have to sign the consent form and then the 16, 17-year-old can go in on their own? Can you clarify that for us?
Thank you, Councilmember Rice, for the question. So yes, consent is required for those under 18. There has been some flexibility in the past in terms of immunization models. For example, we were working with a group to do mobile vaccines in school settings that would have allowed for kids to bring, and sorry, the 18-year-olds, as a pediatrician, everybody under 24 is a kid to me. So allow the kids to be able to bring in a signed consent form and be able to still get the vaccine. So I think there is, we'll just have to clarify with legal, but I think there is some flexibility around that in terms of being able to administer as long as the consent has been provided by the parent.
Well, thank you for that. I think that's incredibly important. And as we're looking to market to young people, we can't forget that the parents still have to sign off. I know I have one that's about to be 16. So it's one of those where, again, it still is necessary for parents to sign off. So we'll still need to market to the parents in addition to the children to make sure that we can get them there, that their consent forms are signed, and make sure that parents are on board. Because that's one of the other things that I know you deal with, Dr. Gales, all the time as a pediatrician with other kinds of vaccinations that parents don't let their children get. So, I mean, it's one of those where I think, we certainly want to market to young people, but at the same time, we still have to not forget about parents. And so partnership with the PTSAs, certainly the adults that are there, would be incredibly important to ensuring that we can get these young people vaccinated. So to that end, with county facilities, I'm just very curious because I've noticed that, at restaurants, things like that, there is this great enhanced cleaning that goes on in between clients that come in, stores, same thing, there's enhanced cleaning. Are we doing the same thing with county buildings, recreation centers, parks, especially when it comes to bathrooms, things like that? When I picked up my daughter this past weekend, I paid very close attention to what airports were doing in their airport bathrooms, and they have what seems like enhanced cleaning mechanisms. So are we doing the same thing in the county as well?
Yeah, we have been throughout our county buildings doing enhanced cleaning. We've had cleaning teams since the very beginning. I would, however, caution, and I think there's a lot of shifting perspective on this, even from the CDC, if you did comment on this, is that what we understand about COVID-19 transmission has shifted over the last year. We've learned a lot of things about how much of the transmission is likely borne by aerosol or airborne transmission versus what's transmitted through fomites, which are objects that you touch like surfaces or pins or whatever. And the growing evidence is that the contribution of fomite transmission is likely a much smaller level. And so we've actually shifted away from some of the recommendations of the hourly cleaning, for example, or some of the really intense cleanings. You do need to clean surfaces on a regular basis. I think that's probably why we've seen a reduction in flu, candidly, is because we've done a lot better with, which, flu is much more transmissible through a fomite typically. And so I think that is, it's a good practice, but probably one that is less, has become clearly viewed as less important than other things like distancing and face coverings are, particularly indoors. And so I think we are still doing cleaning at an enhanced level relative to pre-COVID. We're doing not as much cleaning as we were doing at the beginning of COVID when we had a perception or understanding of COVID as a much different illness than we do today.
So my last question deals with graduation. And so it's very interesting because we hear so many folks on multiple sides of the issue. Let me just say, as a parent of a former graduate, so my daughter graduated last year, we had pushed for something similar to what currently is before and what you have recommended for the school system. We prayed for that. We begged, and Dr. Smith will tell you, Dr. McKnight will tell you, I was bringing up all different kinds of proposals, working with PTSAs to try and figure out. So let me just say this. While every parent would love to have their child in an arena, walk across the stage, and do the same thing that they did, parents are going to be appreciative of whatever it is that you can do beyond what my daughter did, which was stand in front of a banner in front of her high school, and we took pictures from a car that was probably about 20 feet away. That's the reality of where we were last year. And so I just want people to remember that as people continue to push for things that, again, as you said, Dr. Stoddard, it's not necessarily about hard surface transmission. It is about aerosol transmission and about, folks screaming and clapping and yelling and all the things that happen at graduations that we know put more people at risk as people are pushing towards 3 feet distance instead of 6 feet distance. Look, at the end of the day, we're still trying to keep people safe, and we still have a pandemic that's upon us. We still have students who are contracting COVID. Every day we get the updates, we see it. So it's still happening. So let's not pretend as though the virus isn't there. Let's not pretend we have a crystal ball and that we know that in June everything's going to be fine and everything's going to disappear. We don't know that. So we need to stop saying that, because I feel as though that's irresponsible and, quite honestly, risky in terms of what it is that we're doing in terms of assumptions. We need to be cautious. We need to make sure that we stamp this out. And the people who suffer are the people who look like me. And so I will not let people who look like me get jeopardized by folks who just want to have something for the sake of having something. I know that it sucks. It hurts. My daughter still, now that she's home from college, is still talking about the fact that she didn't have a graduation. But the reality is that as a father, she's safe, she's healthy, and that's my number one concern. And so I hope that people have patience in understanding that we are so close. but let's not push ourselves too far beyond what I think we know is still safe for us as we're about to get around the corner of this pandemic. So, Dr. Gales, do you feel comfortable with the recommendations and the suggestions that you've given to our school system that allow them to balance some of the wants that we know that all of our parents and students have, that I wanted as a dad for my child? So I certainly understand, with also coupling that with the safety of all of the folks that will be there in attendance, the teachers, the staff, the students, and other parents as well, in terms of making sure that we can provide an event that balances both of those needs.
Thank you, Councilmember Rice. I would say yes, from a public health perspective, we do support what has been put forward and recommended. And again, to building upon your comment about predicting in the future, you know, we do hope that we're in a different place a month from now, or in June, or in July. And the approach that we have taken has been, you know, in terms of trying to work with people in planning, is to say, here's what you can plan, and here's what we can safely say would be approved and doable based upon where we are right now. And if the future changes and we move in a different direction and more allotments are allowed or restrictions are lifted, then that could create the opportunity for those plans to be revised to scale up even higher. But as it currently stands with what's been put forward, we do support what has been put forward before you all today from a public health perspective.
Well, I just again want to thank you. As a parent, it really is one where, again, that flexibility is appreciated. It may not be, like I said at the beginning, what everybody wants, but the reality is that the ability to be out there in some sort of capacity, even in a limited capacity, even only if, you know, my wife were to be there and I wouldn't be able to, and I'd have to wait outside, whatever the case may be, it would still be better than what it was last year. Tremendously better than a parking lot banner graduation. So again, I just caution us about what it is that we're asking for and doing, understanding that we are light years from where we were last year. So thank you very much. Back to you, Mr. President.
I have one more comment too. I think this is really important to recognize that the governor still has a requirement for physical distancing, as he should. And I think that for the capacity for most of the venues that we're talking about for graduations, the limitation will be more having that separation between people than it will be a percentage occupancy. I suspect even though there were 50% occupancy for all of these stadiums, for example, I don't think that all those stadiums can handle 50% occupancy with physical distancing. And so I think it's got to be clear that because of the existing requirement, and again, that requirement should be there. Because of that requirement, the percentage constraints on the stadiums will be less onerous than the fact that they have to distance 6 feet, because many of them are based on a stadium seating model where the person to your left and your right, you can spread out on a row, but front to back, you may have to skip multiple rows to get that 6 feet of distance between people and do some, sort of thatch work, alternating spots and things like that. And so we really ran into this with the spectators with youth sports, where we had to go through and MCPS worked with us to map out exactly where 6 feet of distance were in stadiums. And it became pretty clear that it's more challenging in a stadium setting than people realize to have that distancing, not just when you're seated, but also the bottleneck points of restrooms and entranceways and exitways. And so I think MCPS has put together some really good plans. I've seen similarly some very good plans. I think Ivy Mount sent us their graduation plan, which we approved. Other graduation opportunities people have been really smart about it, but I think they're realizing that it's more complicated when you have to consider distancing than just a percentage occupancy.
Okay, thank you, Council Member. Thank you, Dr. Stoddard. I think all my colleagues have asked all the questions on my list, unless I missed it, except for one, and that is I promised to raise, is there any update or any anticipated update on the issue of concessions in theaters? I understand the concern regarding unmasking and duration and difficulty of enforcement, but some state lawmakers who felt sort of singled out brought this up. Is there any update we can provide them on that?
I don't have any update at this time for that. I will say that we have discussed that as part of our larger conversation about the next steps for reopening in terms of, types of activities that would be permissible based upon, the metrics that we've been looking at, and also factoring in increasing percentages of those vaccinated.
Councilmember Reamer.
Thanks. I just want to make a general point here. If everybody takes the vaccinations, we can go back to normal. That's the whole point. And we are on pace. We are doing really well with our population getting vaccinated. We are over half of the eligible population has received a first dose. And I don't know what our daily pace is. Last time I checked, it was 6,000, 6,500 a day. Another month of 6,500 a day. That's 300. I'm going to make a mistake and do math in my head, but that's 300,000 people getting a first dose in a month. That's probably exceeds the number of people remaining to get a first dose. So within a month at this pace, everybody who wants to get a first dose should have gotten one. And I think it'll be about, are we succeeding in reaching communities where there's just not as close of a connection, where they're not as much part of the health system and so forth. That's where we'll be in a month. So I don't know why we wouldn't have at that time a general sense of we can be open. Are we really going to say that this summer, even though almost everyone has been vaccinated, the only people who haven't either don't want to or just haven't been yet reached, that for that fraction of the population, everything else will continue to be closed? I don't think that's tenable. I don't think the public will embrace that. So I don't think that's what anybody wants. But, I do think unless we are no longer on pace with our vaccination campaign, then I think we're heading in the right direction. And you can see from the UK, I heard that the UK had 1 death in 3 days. They're doing the first dose first, which America should have done. I think it's an historical failure that we didn't do that from the beginning. And as far as the school situation, it's troubling to me. The Maryland is lowest in the country with students in school, and Montgomery County is lowest in the state. So I'm not sure history is going to judge us well on that. I really am not. But sorry, Dr. Gales, you wanted to comment.
Sure, thank you. I want to clarify this for the folks at home watching and let folks understand and be clear. We don't advocate for keeping things closed any longer than
You're very muffled, Dr. Gales.
Can you hear me now? Is this better?
Better.
Okay. All right. I'll stand up.
I don't know if maybe you have a paper in front of your microphone or something. I don't know. It's the first time I've heard.
I think it's just the wireless connection. It's the county Wi-Fi. So, so I just want folks at home to understand is that we, from a public health perspective, we don't advocate keeping things closed any longer than we feel are necessary to keep our residents safe. And I would like to say a special thank you to, in fact, all of our residents for adhering to what we've asked you to do, and also getting out and getting vaccinated at a high clip. It is because of all of those things and because of the cautious approach in terms of reopening in comparison to the rest of the state that I do think we will be in a better place in a few weeks in comparison to the rest of the state in terms of our community transmission levels, as well as the percentage of our folks vaccinated. What we don't want to have happen is we rush to reopen things and we are in a situation where we see cases increase. We look across the state, the numbers have doubled since early March, where we would have to be having conversations again about closing down activities, particularly given that we see increased hospitalizations. And unfortunately, we haven't reached a point as the UK where we're only having a death every 3 days. We're still seeing, COVID-related fatalities across the state. So I, again, just want to emphasize that the guidance we're providing is taking a cautious approach that has played out when you look at the numbers across the state where we are compared to other places. Again, this isn't a competition by any stretch of the imagination, but it underscores trying to balance safety as well as promoting, economics, business, and getting folks back to a sense of normalcy. We do expect, if we continue to adhere to that we will be in a different place. And as I mentioned multiple times in the briefing today, we will be putting forward in the very near future new guidance that does take into consideration, for example, percentage of folks who are vaccinated and covered that would allow for us to be able to open up further, again, respecting those safety parameters in place.
Thank you. I'll just close now and just say, our kids should be our first priority. And as adults are vaccinated, especially now, I think it's really time to let our students and our children have more of a return to normalcy. And, the vaccinations are now available. All adults are eligible. I think it's time to let kids back into libraries, go to 3 feet. Like, let's, our kids need us. We should be there for them. Thanks.
President Bryce.
Okay.
So let me just say something. I've been vaccinated. My mother's been vaccinated. My father's been vaccinated. My wife still has not been vaccinated. My oldest daughter has not been vaccinated. And my youngest hasn't been vaccinated. Let's stop pretending as though just because we think that there's a certain number of vaccines out there that everybody can get vaccinated. There's still on the list waiting, as many people are who want the vaccine, who are still waiting for appointments. And so, again, I think it's disrespectful to folks to try and push folks into situations without having the availability that we know still has not been there. Now, we hope that that will come, and I appreciate everybody who continues to work hard to make that happen. But again, let's not paint these false narratives of, everybody's got a vaccine who wants it, and everybody's good, and everybody's moving forward. That is not what's happening. Folks are still waiting, and who want the vaccine, who are trying to get the vaccine, who are using multiple sources, who don't have the time. My wife works in a service industry. She does not have the time to be sitting on a computer clicking when Walgreens first comes out with appointments. And so, again, keep in mind that there are people out there, especially in our service industry, who are working each and every day, putting themselves at risk to just make sure that they're putting food on the table. And they're also hoping to be able to get vaccinated. And so, again, let's make sure that we're being sensitive and respectful to those folks who continue to want to be there, who continue to want to be safe. And let's not also remember that just getting vaccinated does not mean that all of a sudden you're free from risk. There are plenty of people who've gotten vaccinated, some who have been told the story right here in this council. Councilmember Katz told the story about a person who got vaccinated who still got COVID, and it can be transmitted to other people. So again, from my perspective, even though I've been vaccinated, I could still pass it on to my wife, pass it on to my 2 daughters, and they could get it and have serious complications. So again, there's still a lot of risk out there. Let's make sure that we're also reminding people about that as well. Let's not forget that. Because again, I don't want us painting this fairy tale picture that doesn't exist right now. Yes, I wish and I hope for it. I pray for it to be soon, but it's not upon us right now. And so let's again be real about what it is that we're telling our folks, our community, so that they can continue to be safe and keep their family safe. That's what's most important. Thank you.
I know my colleague is aware. I did not say that anyone who wants one can get one now. I didn't say that. Thanks.
Councilmember Jawanda.
Thank you. Just want to, as always, don't have a ton of questions. A lot have been asked. Thank you to our public health team for all you're doing. Dr. Stoddard, the number again of people who are on the pre-registration list who have been sent an appointment versus who haven't. I know you said it earlier. I just want to
apologize. Let's bring it back up. There's about 126,000 people, 126,000 people, and approximately 79,007 people have been sent invitations, and the remainder, which is about 47,537, have not.
Okay, so there's almost 48,000 people who have pre-registered, won a shot, haven't been sent an invitation yet.
Correct.
Of the 126,000 on the list, and obviously we still want people to get pre-registered, and you guys are making great progress despite the fact that we've had less supply than we've had in some weeks, but hopefully that'll keep going up. And I appreciate the comments from Councilmember Rice. I think I just really don't like the way. I think one of the big things of this era will be politics involved in health decisions. I mean, there's going to be books written about it, and it's not a great system. And I think we need systemic reform in how we do public health because of what's happened here across the country and other places. But that being said, I think we've done a great job for the most part, listening to the direction of public health, and that has served us well to be the largest jurisdiction and to be in the position we are with vaccination rates, despite the deep disparities, which are mostly communities of color, that we've made significant progress, and our rates reflect that as far as our infection and case rates. And so I want to thank the team, and we are moving in the right direction, but we just need to keep doing what we're doing. And I know everyone wants to get out there and do things, but I hear every day from people who aren't, for a number of reasons, who aren't vaccinated and are trying to get access. And so we just need to keep pushing. And I appreciate all the work that you all are doing. So thank you. Thank you, Mr. President.
Thank you. Okay, I don't see any other requests to speak. All my questions have been answered. Thank you all for everything you're doing. It's terrific to both see the progress that you're making and to get the updates every week. So now we can move on to the formal introduction of the amended Board of Health regulation. I'll remind everyone on April 13th, the council added guidance for the operation of summer camps in the current local order. Today, we're going to add guidance for school graduation. Let me now recognize the council's senior legislative attorney, Bob Drummer, to explain the resolution to the public and take questions. Bob, my first question, was that a slick new Zoom portrait you're rocking today?
No, it's the Potomac River.
Oh, your background, but the red polo I like.
Oh, the red polo. Oh,
I think that's.
I'm not sure why it pops up sometimes and sometimes it doesn't. I think it's got to do whether I'm on the VPN or not.
Your media consultant's doing her job, so.
Yeah.
Very sharp.
Yes.
Thanks. Okay. Good morning, everybody. We are here for the Fourth Amended Board of Health regulation. As you remember, the first amendment dealt with sports, the second one with spectators at sports, the third one last week with summer camps, and this one is school graduation ceremonies. And briefly, the limits on school graduation ceremonies are for outdoor ceremonies, it's 50% of the outdoor venue's maximum occupancy. If the outdoor venue doesn't have a formal certificate of occupancy, we would use 40 square feet per person in order to calculate the occupancy limit. For indoor graduation ceremonies, it would be limited to 25% of the maximum occupancy, or 250 people, whichever is less. A school that plans an indoor graduation ceremony must obtain a letter of approval for their plan showing how it would meet the general requirements of the regulation. And the general requirements for both indoor and outdoor include a record of everyone attending the graduation being kept for 30 days for contact tracing. The school must identify a point of contact for an attendee to notify if they test positive for COVID-19 within 2 weeks after the event, and the point of contact must notify our Health and Human Services Department within 1 business day of finding out about a positive test. No more than 10 people can be on stage at any one time. The ceremony must last 2 hours or less, although the venue can be open for at least an hour before and after for ingress and egress with socially distancing in force. Members of the audience from different households must remain at least 6 feet apart at all times. There must be signage explaining the infectious control requirements posted at the venue. No group or stage photography. No congregating or gathering in common areas, both inside and outside of the venue before or after the ceremony. A masked speaker must be at least 12 feet from the audience, and if the speaker is unmasked, it must be at least 18 feet from the audience. Diplomas must be distributed without handshakes or physical contact, and no food or beverage concessions at the ceremony. That's a summary of the guidelines for school graduation ceremonies. I believe you've got a public hearing scheduled with at least 2 speakers, and it's tentatively scheduled for action at the close of the public hearing.
Thanks, Mr. Drummer. That's terrific. Council Vice President, do you want to speak now or after the public hearing?
After the public hearing. Thank you.
Terrific. Ms. Kennedy, could you introduce the speakers for the public hearing, please?
I will be doing the...
Hi, Ms. Mass. Thank you.
Okay, our first speaker for today is Mr. Rami Kendall. I would like to remind all the speakers that each one of you have 2 minutes to give your testimony, and I will let you know when your time is up. Mr. Kendall?
Hi, can you hear me?
Yes.
Hi, good morning, members of the Montgomery County Council. My name is Rami Kendall. I'm proud to say I've been born and raised and still live in Montgomery County, Maryland. My wife, Melanie, and I are the proud parents of 4 children, one who graduated from MCPS school in 2019, a senior who's graduating this year, an 8th grader and a 6th grader. As I'm sure you can all imagine, the last 13 months from an education perspective has been very difficult and detrimental to my 3 kids who are in the MCPS system. My senior has lost all of the things he was looking forward to during his senior year. However, the most important thing that he and all the seniors have left is a graduation ceremony from high school. The entire MCPS graduating class of 2021 has not had a typical senior year experience. No homecoming dance, no fall football nights, no class of 21 car decorating, no prom, none of the last year together celebration of milestones. But these kids have worked hard, navigating a challenging COVID year, and done their part to proudly finish their high school years. Realizing that COVID should not overwhelm all of the class that 2021 has accomplished, the academics, the athletics, the community service, the clubs, the good causes, and good cheer, let them have their in-person graduation, outdoor socially distant graduation. Be brave and let their kids and their families celebrate them. As of Friday, April 16th, the county had vaccinated approximately 44.3% of the population with 1 dose, and approximately 26.9% are fully vaccinated. I would estimate by the end of May that we should have over 50 to even 60% of Montgomery County population fully vaccinated. Based on what Dr. Fauci said on the news over the weekend, he is expecting the J&J vaccine to come back online by this Friday. In addition, I just saw in the news today that Israel has removed the mask mandate with over 60% of their population vaccinated. To cancel or severely restrict these outdoor graduations seems very punitive to me. We live in the county that houses the National Institute of Health, the county that Dr. Fauci is working from on a daily basis. We should be following the recommendations of Dr. Fauci and other leaders getting us out of this pandemic. Please follow the science. Do not take away the graduation from their kids and their families. So much has been taken away from them already. Thank you very much.
Thank you very much. Our next speaker is Mrs. Sarah Kessler.
Hi, good morning, council members, and thank you for the opportunity to testify. I want to express my appreciation for the new guidance on high school sports, which was efficiently expedited, allowing me to witness my freshman field hockey games and walk with my senior on the Palms team at parent night. To say this year has been difficult for our seniors is a gross understatement. While families of athletes appreciate the recent sports allowances, parents of high school seniors are desperate for their children to be publicly recognized for their academic accomplishments at in-person graduation events. Thank you, President Hucker and Vice President Albornoz, for the time and effort you've devoted to the outdoor graduation plan for MCPS. The combination of an extremely low chance of transmission outdoors combined with wearing masks and an ever-growing percentage of vaccinated residents should leave no doubt about the safety of in-person celebrations. I noticed, however, that county vaccination levels are not considered anywhere in the 4th amended Board of Health regulation. Current CDC guidelines state that fully vaccinated people can socialize without masks or physical distancing and refrain from quarantine and testing following a known exposure. Now that appointments have opened up, all county residents aged 16 and over, hundreds of high school students are getting vaccinated every day. The county could choose to prioritize high school seniors whose families have trouble navigating the system to ensure that every senior is vaccinated in the coming weeks. Specific clinics could be designated at a few high schools throughout the county in order to be easily accessible to our student population. And I want to address Mr. Hucker's question earlier. There has been no outreach from MCPS at all about facilitating vaccinations for students. With the typical capacity of 4,000 at MCPS stadiums, graduations of 2,000 would comply with the 50% guideline while accommodating graduate staff and 2 guests. I also want to address Dr. Stoddard, who talked about the inability maybe of having everyone spaced out 6 feet in a stadium. Does not take into the account that over 50% of the attendees will likely be fully vaccinated. Thus, the 6 feet of separation doesn't apply to them. After a year of watching our seniors sit at home, sinking deeper into depression as they missed every final milestone, parents and students are filled with hope about end-of-the-year celebrations. We anticipate approval of the waiver to allow students to graduate with their classes outdoors. I ask that you approve the waiver with a condition to revisit expanding capacity and/or format by May 15th in consideration of the rising percentage of vaccinated residents. Thank you very much.
Thank you very much, Mr. President. This wraps up this public hearing.
Thank you to our speakers. Thank you, Ms. Mass. This public hearing is now closed. Since the beginning, of course, we followed the advice of our top medical officers and our emergency management team, and will continue to do so. I'm really grateful to all of them for all their hard work in general, but particularly all the thought that went into this proposed resolution. Not only the caps on the size, but the requirements for an approved plan and the requirement to maintain a list of attendees and the other details. It's a very thoughtful proposed resolution. And I know all of us are disappointed and aware of the sacrifices our students have had to make over this last year and understand the importance of in-person graduations. That was some excellent testimony. And I know want all of our residents to understand we'll continue to reassess our measures as needed and continue to take a measured approach to allow a responsible and equitable reopening while we keep an eye on the safety of our students and families. Council Vice President Albornoz.
Thank you, Mr. President. I just have 3 comments, and then I'll make a motion to move forward this updated Board of Health regulation. The first comment is that this mirrors what the District of Columbia has done with graduations. And I think that's significant because, as we've all been saying from the beginning of the pandemic, including our public health officials, following a regional approach to these critically important decisions is very helpful from a consistency standpoint. And as we know, there are independent schools, as an example, where a number of students may reside in the county or go to school in the District of Columbia, or vice versa. And so I think that's a good message to send. The second is that this is a great example of our public health team taking the initiative, listening to, following the science, and finding a sweet spot that I think does address the very difficult balance that all of us have had to incur since the beginning of the pandemic, with allowing these important milestone events to move forward, but also making sure that they're done safely. And so I think this is a great example of that. And finally, and I know I speak on behalf of all of my colleagues here, congratulations to the graduates. That testimony was so powerful from our parents, because we know that this class and last year's class as well, and Councilmember Rice has spoken so eloquently about the impact of this and the first person on his family. We know the sacrifices that these youth have made on behalf, frankly, of all of us, and to keep all of us safe. And your resilience and your strength and your leadership has not gone unnoticed. And I know this has been painful, to say the least, but we stand with you, and we'll support you coming out of this and do everything that we can to support you. So I can't wait to participate in some of these graduation ceremonies for some of my extended family as well, but again, to do so safely. And this represents another important milestone moving forward in our fight against this horrific and tragic pandemic. So with that, Mr. Council President, I move that we update the Board of Regulation as before us today.
Thank you, Council Vice President. Is there a second?
Second.
Councilmember Friedson seconds. Terrific. Any additional discussion? Okay. I see no request to speak. Let me just say I'm very proud of this whole council through this pandemic. We have been making policy on the advice of our health professionals in real time with no manual. We have additional responsibility as the Board of Health now that the governor has dialed back the county executive's authority. And we've continued to hear from and respond to the feedback we get from our very active residents. So it's been a very good experience to see how this council's responded in real time, followed the guidance of our health professionals, and we'll continue to do so and continue to monitor the numbers. I think it's been very thoughtful and very responsive. So with that, we have Council Vice President Albornoz has made a motion. Council Member Friedson has seconded the motion. All those in favor? Well, no, we need a roll call vote. I'm sorry, Madam Chair. Madam Clerk. And I need more coffee, apparently.
Mr. Glass?
Yes. Yes.
Oh, Mr. Glass votes yes. Mr. Giwando?
Yes.
Mr. Giwando votes yes. Mr. Reamer?
Yes.
Mr. Reamer votes yes. Ms. Navarro?
Yes.
Ms. Navarro votes yes. Mr. Rice?
Yes.
Mr. Rice votes yes. Mr. Friedson?
Yes.
Mr. Friedson votes yes. Mr. Katz?
Yes.
Mr. Katz votes yes. Mr. Albornoz?
Yes.
Mr. Albornoz votes yes. Mr. Hucker?
Yes.
Mr. Hucker votes yes.
Thank you. So the amended Board of Health regulation passes unanimously. We can now move to interviews for the Board of Investment Trustees for Montgomery County Employee Retirement Plans and the Board of Trustees for the Consolidated Retiree Health Benefit Trust. We're a little bit behind schedule, so we'll try to move quickly through this. We'll be interviewing two candidates, Mr. Alexander Cochran and Ms. Christine Kelleher.
Mr. President, you're actually a little ahead of schedule and the candidates are not quite here yet. So we suggest moving on to the other items on the agenda, the next items on the agenda first, to give them a little bit of time. The interviews were scheduled for 11:30, so.
Oh, you're right, we caught up, okay. Well, next is the appointment to the Merit System Protection Board. Are we ready for that?
Mr. President, I would do the consent calendar first and then the Merit System Protection Board.
Great. Okay, colleagues, we have a consent calendar in front of us as item 6.
So moved.
We have a Councilmember Reamer has moved. Is there a second?
Second.
Councilmember Katz has seconded. All those in favor of the consent calendar?
Mr. President, I just want to
yes, Councilmember Navarro and then Councilmember Friedson.
Thank you so much. I want to highlight the introduction of the resolution in support of the Metropolitan Washington Council of Government resolution supporting statehood for the District of Columbia. The sponsors are Council President Hucker, myself, and Councilmember Glass. Last week, during our meeting of the board of the Council of Governments, we had the distinct honor of adopting this resolution. In other words, the entire leadership of the region came together to make this an official, codify this as an official position of the Council of Governments. Very important resolution as this is now being debated in Congress yet once again, but no doubt, I think, has the type of momentum that we have not perhaps seen in quite some time. And so this is introduction. I would like for residents to take a look at the resolution itself. I just want to read one of the whereases that is so important. With a population of 712,000 residents, the District of Columbia exceeds the population of 2 states, anchors the metropolitan statistical area that is the 6th largest in the nation, and its residents pay annual federal taxes of more than $27.5 billion, more per capita than any state, and more federal taxes than 22 states. It is really important to consider that as one of the many reasons, but also how completely egregious the whole issue of equity plays a central role in why DC has had to fight for this particular recognition that it rightly deserves for so many years. So I wanted to just highlight this very important resolution. Other jurisdictions are doing the same, affirming the Council of Governments resolution. Of course, here in Montgomery County, ably led by Councilmember Glass, we were a little bit ahead in our enthusiastic support. But what this does is that it officially acknowledges that as as Montgomery County being already so supportive of this, that we want to codify this as well. So I thank you, Council President, for putting this on the agenda. And again, I think that when you read all of the whereas clauses, it truly gives you a robust snapshot as to why this is so critically important and why we need to send a very clear message to our federal representatives. Thank you.
Absolutely. I'm proud to serve on the Council of Governments board with Councilmember Navarro, and I echo all that before we move on to the other topics. Over 712,000 residents in the District of Columbia. I used to be one of them, and a majority, of course, are Black and other persons of color. And the fact that they're denied the basic rights and privileges afforded to other citizens is one of the great civil rights injustices of our time. We just heard from the Council Vice President how the fact that our graduation guidelines, just the latest policy matter, the fact that they're aligned with DC is tremendously helpful from a policy and a public health perspective. And that's been the case in our work with DC through the pandemic, through our support for WMATA, through following the COG resolution on the housing emergency, on the climate emergency, and racial equity, and many other policy matters. Given the interconnectivity with the population living and working right next to us in the district, and the fact that so many of our residents work in the district as well, I'm really proud the council's taken decisive action on this matter to stand with our neighbors in the district and unequivocally support the district's quest for statehood. And grateful to Councilmember Glass for his work on this as well. Councilmember Friedson.
I was actually just trying to vote, so I wasn't asking to speak. I was raising my hand a little bit early, so spoiler alert, I'll be voting in the affirmative on the consent.
We look forward to your vote. Councilmember Glass.
Thank you, Mr. President. And I'll just quickly say that I'm pleased to be joining you and Councilmember Navarro in the resolution to support DC statehood, because as both of you noted, we were early supporters of this effort, and the rest of the country and hopefully Congress will catch up to our enthusiasm as well, because quite frankly, DC is not only the heart of the nation, but it is also the heart of the Washington, DC region. And we all want residents of DC to know that we stand with them in their struggle for fair representation, and the hundreds of thousands, 700,000 residents, friends, neighbors, coworkers who live on the other side of Eastern and Western Avenue deserve all the same rights that we do have here in Montgomery County. So look forward to raising the flag with the 51st state soon enough. Thank you.
Excellent. Councilmember Glass.
I know we look the same, but I'm Reamer.
I'm sorry, Councilmember Katz. I meant to say Reamer. Sorry.
You know, that really is quite a compliment for me. It was not a compliment for Councilmember Glass, but at any rate, thank you very much, Mr. President. I just would like to be added, please, as a co-sponsor for item B for DC statehood. Thank you.
Thank you, Councilmember Reamer.
Thank you. If I'm not a co-sponsor, I would love to be added as one, please. And I'm really grateful. I think that the solution that was being discussed for DC statehood was really brilliant about carving out a federal district and allowing for the residents to, it just addresses some of the pushback questions. And I certainly hope that that Congress will take action now in this moment. And I think Puerto Rico should be a state too. You know, I think we need them to ask for it, but I really think it's time. You know, it's a matter of respect for the people who live in these communities, and it's overdue. And you know, we should welcome them into the status of statehood.
Councilmember Rice.
Thank you. I'd just like to be added as a co-sponsor for DC statehood.
Councilmember Chawanda.
Would like to be added as a co-sponsor as well. And I'm thinking I'm not the only one on this council that was actually born in DC at the GW Hospital. At least I was brought home to Long Branch, but born in Washington, DC, and lived there for quite a long time and went to college there. So I'm really excited about this and really appreciate Councilmember Glass and Navarro and Hucker and all of us for really pushing for this.
All right, terrific. So there's a motion.
Mr. President, I didn't want to.
Councilmember Vice President Albornoz.
Thanks. Well, I was going to speak to the repeal of the pager criteria policy. I'm just kidding. I was not going to speak to item number H. I would also like to be listed as a co-sponsor for DC statehood. Thank you.
Terrific. Sounds good. All right, we have a motion and a second to pass the consent calendar. All those in favor, please raise your hand. There we go. 9. Okay. The motion passes unanimously. Madam Clerk, can we go back to the Board of Investment Trustees?
Yes, they are both here.
Excellent. Okay. Welcome, Mr. Cochran, Ms. Kelleher.
Good morning. Thank you for having me.
Good morning.
You bet. Thank you both for appearing and for your willingness to serve. I have 4 questions to ask you each. I'll see if my colleagues have additional questions. I'll alternate in who goes first, to be fair. And I think they've been shared with you anyway. But Mr. Cochran, please share with us your background, knowledge, and experience related to retirement planning, investment, and financial matters.
Great. And first, thank you again for the privilege. I'm a Montgomery County resident, so I'm honored to be part of this process. So thank you all for your oversight and focus on this matter. In terms of my background, I'll start with where it began with Cambridge Associates, which is a financial consulting firm doing advisory work for endowments and foundations. It's there where I learned the best practices as it relates to asset allocation and performance measurement, particularly as it relates to pension plans and other institutional clients. I then went to Goldman Sachs, where I spent nearly a decade as part of their manager selection business on behalf of their institutional channels and clients, serving both pension plans and other institutional investors. There, I was a senior member of the investment team focusing on public equities and public fixed income, 2 primary allocations as it relates to pension plans assets. I was also a member of the liquids portfolio allocation group, and that team was responsible for our asset allocation within our public fixed income and public equity investment vehicles. Most recently, I've been with Lockheed Martin and their pension plan, which is a top 25 pension plan pool of capital in the nation. I've been with them for 5 years, so I'm active in the pension space, confronting the challenges that are ever changing with the regulatory environment and the market environment. And at Lockheed, I focus on 2 investment disciplines, again, in a multi-asset class fashion. On the public side, I help with our external manager selection and portfolio strategy and asset allocation within public equities. Additionally, over the last 5 years, I've been spending time in the illiquid asset allocation side, specifically on the private equity and real estate portfolio. There, I focus on portfolio strategy, portfolio construction, and risk management.
Terrific. Ms. Kelleher?
Good morning. Thank you so much for having me. It really is a privilege to be here today and to be considered for this position. I come from a background of almost 17 years now of investing assets on behalf of mission-related institutions. My career began, this phase of my career began investing Georgetown University's endowment and deferred benefit retirement plan and small healthcare trust. So in that position, I spent 9 years building out a full team of investment professionals and working with the Board of Trustees to develop an appropriate asset allocation for all three pools of capital, developing asset class strategies, choosing managers, and implementing the investment program for the university. For the last 4 years, I have been Chief of Investments at the National Gallery of Art here in Washington, D.C. Very much appreciated your last vote. And here too, I am primarily responsible for managing the institution's endowment, but I also oversee the executive deferred compensation plan. Again, very similar to Georgetown, but instead of having an internal team working with consultants on advising the Board of Trustees on an appropriate asset allocation, investment strategy, and manager selection for the pool of assets that we manage.
Terrific. Thank you. Second question. This board is responsible for overseeing the investment of roughly $5.5 billion in assets for approximately 16,500 active and retired members of the three retirement plans: defined benefit, defined contribution, and deferred compensation. Can you please explain your relevant experience that will enable you to make informed decisions on these matters? Ms. Kelleher, you're first.
Sure. So, my understanding in speaking with the staff and other board members is that this is, a very well-run, well-funded plan that actually applies an endowment model to its investment program. And again, I think coming from 17 years of professional background in this space, as well as working with actuaries and consultants on the retirement plan at Georgetown University, will help inform me in guiding the staff and the board in being appropriate fiduciaries for these pools of assets on behalf of civil servants of Montgomery County.
Thank you. Mr. Cochran.
Yes, so throughout my 15-plus year career in investment management, I've been participating in manager selection and asset allocation decisions. First, as a consultant who did advisory work for institutional clients. Secondly, with Goldman, where I was an advisor for one of the largest public plans in the nation as it relates to the pension assets. And now most recently with Lockheed. Lockheed's size and scale is somewhat similar in terms of some of the underlying assets. Lockheed is managing, or at least I'm helping oversee, $20+ billion in our public equity portfolio. So I'm well aware of the challenges that are facing the defined benefit program. I think based on my conversations with prior board members, as well as the investment staff of the team, is doing a phenomenal job. But I do think there's some unique challenges at the DB level, defined benefit level, as it comes closer to the end game in terms of their solution. So I think my direct experience with Lockheed is very relevant for what is happening with the DB plan, given the status of the funded nature of the plan. On the DC side, Lockheed has more recently gone through a restructuring, some quite well of some of the enhancements that are potentially available to underlying plan participants, and would like to be part of those conversations as we think about empowering customization and digitalization of the DC program. And then lastly, while with Lockheed, I help oversee some of the other trusts, including the defined contribution trust. So I'm very well aware of the different objectives and some of the universal philosophy that can be managed across those pools of capital.
Thank you. Third question, why do you want to become a member of the Board of Investment Trustees? Mr. Cochran.
Yeah, it's very personal as being a resident here. I see a lot of the frontline workers on a day-to-day basis. I've enjoyed my career in the investment management realm, and we always look for this intersection of where there's a personal passion of being connected to a community, and then helping that with my underlying skill set. Lastly, it's an honor that I've been a fiduciary throughout my career, and it's a responsibility that I take humbly, and I look forward to continue to be part of that from a Lockheed perspective, and potentially being part of a fiduciary on broader plan participants as it relates to Montgomery County.
Thank you. Ms. Kelleher.
So I do also see this as a way to give back to the broader community. I am a resident of Washington, D.C., and I work in Washington, D.C., but our family certainly benefits from the services and economies of the surrounding counties. I've always been very driven by mission and a sense of service, and I hope that you'll give me the opportunity to do so for Montgomery County's pension.
Thank you. And the fourth question is, are there any current or potential conflicts of interest of which we should be aware? Ms. Kelleher?
There's nothing that I am aware of that could be considered a conflict of interest at this time.
Thank you. Mr. Cochran?
Nothing that I'm aware of. I've actually discussed this topic with my general counsel at Lockheed, and our leadership there is very comfortable with this potential opportunity.
Okay. I don't see any questions from my colleagues. Mr. Reamer.
I'll ask for brief responses as we all are, and we have a lot of work to do. Could you just talk a bit about climate risk and how you think a portfolio can responsibly consider climate risk in its strategy?
Sure. Go ahead, Christine.
Sure. So this is an issue that we dealt with at Georgetown, that we were talking about at the gallery, and that is very important to me as well. I think that it is really hard to ignore climate risk when trying to evaluate risk of your investments. And we are hoping and prefer at the gallery for investment managers to ensure that that is part of their risk process when they are choosing their own investments. So I think that climate risk is a material risk and should be considered in an investment process.
I would echo that, generally speaking, that there's a lot of ESG and diversity inclusion alignments that we want to be taking in consideration with the financial opportunity set. I would say ultimately we're fiduciaries, and so it can come as an enhancement to the financial results or the probability of those financial results, and look forward to including non-financial factors as part of that criteria.
Thank you. Okay, I don't see any additional questions. So thank you both for your appearance this morning and your willingness to serve. We're really grateful for your participation, and we'll get back to you as quickly as possible.
Thank you all.
So much. All right, colleagues, next we will now take up the council's appointment of Ms. Barbara Fredericks to the Merit System Protection Board. For the benefit of the public, I will just state that Ms. Angela Franco resigned from the MSPB on December 31st, 2020. Mr. Christopher Scott Matavia was appointed by the council on February 9th, 2021, but he had to resign soon thereafter, citing the time commitment. The interview of Ms. Barbara Fredericks was conducted on February 2nd, 2021. In situations like these, the council is authorized to select a remaining candidate without conducting a second interview. Is there a motion to appoint Ms. Fredericks to the Merit System Protection Board?
So moved. I think Nancy was trying to move it, but she may have muted.
Yeah, did not hear me. I'm sorry. So moved.
Councilmember Navarro moves, and is there a second?
Second.
Councilmember Friedson seconds. All those in favor, raise your hands.
Aye.
Terrific. That is unanimous. Congratulations and thank you to Ms. Fredericks on your appointment. We very much thank you for your willingness to serve on this very important board. And now we've already taken up the consent calendar. So colleagues, I believe unless there's an objection, I think we're ready for recess until 1:30 for the district council session.
I think it's unanimous that we should go to recess. That's what I think. Yeah.
Thank you, immediate past president. Very